Credentials for the Lib Dems, Jess Brown-Fuller.
Oh, thank you, Chair. It's lovely to see you in the chair and to welcome the Minister to her place as well. I'd like to thank the Honourable Member for Hastings and Rye for securing this important and timely debate and for giving a passionate and well-informed speech to open the debate. Women's health has been overlooked for far too long, and today's discussion is an opportunity to highlight the urgent action needed to address this crisis in women's health, with International Day due to be celebrated next week. The Forset Society found that nearly 2/3 of women in the UK believe their health concerns are not taken seriously, and more than half have had negative experiences with healthcare professionals. And Chair, I enter this speech very frustrated because during the speech I've had a message from one of my good friends who was ignored 2 years ago when she had pain in her leg, and she's just texted me to tell me that she will now have to undergo a course of chemotherapy and extremely evasive treatments so that she can just retain her ability to walk. My friend is in her early 20s and she was ignored. So I'm very cross. And this isn't just a health issue, it's an economic issue, as the Honourable Member spoke about in her contribution. The UK loses 150 million working days every year due to women's poor health and inadequate support. If we want a healthier, more productive society, we must take action to close the gender gap in healthcare. During a drop-in surgery that I ran in my constituency in Chichester, a woman came and told me that when her daughter started experiencing extremely painful periods, with pain outside of her period, all she could do was cry at the thought of her having to go through the same painful process with healthcare professionals that she had been through herself in getting a diagnosis for endometriosis, which took this lady 9 years. Gynecological waiting lists have more than doubled since 2020, the biggest increase of any medical speciality. And at the end of last year, 755,000 women were waiting for treatment. Behind every number is a woman experiencing chronic pain, worsening mental health and disrupted daily life. And 1 in 4 women with a gynecological condition will end up in A&E because they couldn't access the care that they needed in time. And yet the NHS is failing to prioritise these urgent needs. The Royal College of Obstetricians and Gynaecologists has been clear. This system needs a complete overhaul so gynecological care is given the attention it deserves. An example of this is at St Richard's Hospital in my constituency of Chichester, which does not have a specific gynecological ward. This means that women with gynecological issues or having received treatment are placed across several other wards. This could negatively impact their treatment as it makes it more difficult for them to receive urgent specialised support in emergencies. And as the Honourable Member for Luton North said, the clinicians do not have to do gynecological training as part of their mandatory training. And delays in female cancer care are alarming. Between April 2021 and March 2024, 2,980 people waited over 104 days to start treatment on the 62-day urgent suspected breast cancer referral route. And the Honourable Member for Bath remarked that younger women have much worse prognoses due to a lack of breast cancer screening until women are 50. For ovarian cancer, the average wait from GP referral to treatment is 69 days, one of the longest delays for any cancer. These prolonged waits are not just unacceptable, they have life-altering consequences. Because for generations, women's pain, particularly in maternity care, has been dismissed. This has created a crisis of confidence in NHS maternity services. Several investigations have revealed fundamental flaws in our maternity care and how it's delivered across England. CQC inspection of 131 maternity units found that 65% of them were not safe for a woman to give birth in, with studies showing that 1/5 of all causes of stillbirth are potentially preventable. The CQC has also warned of a normalisation of serious harm in maternity care. This cannot continue, and I held a debate on maternity services earlier this week, calling for the government to fully implement the recommendations of the Ockenden report, which is urgently needed to reform the sector of maternity care for the better. In 2024, Dr. Huck, the Patient Safety Commissioner estimated that 10,000 women in England have experienced harm as a result of vaginal mesh implants, with campaigning groups arguing that the true figure could actually be closer to 40,000. One woman in my constituency asked me to go to her home because she doesn't leave it. She is a victim of the mesh scandal and she is totally isolated from her community because of it. I am a member of the First Do No Harm APPG, which builds support and raises awareness of the recommendations of the 2020 report by the Independent Medicines and Medical Devices Safety Review, and I was really glad to hear the contribution from the Honourable Member from Washington and Gateshead South, who talked about the women living in poverty, isolation, in pain, and so often dismissed by the professionals. And the review found that those suffering adverse effects from medical treatments, including vaginal mesh, found a system that was disjointed, siloed, unresponsive and defensive. And so many of those women are still waiting for compensation, and that's a national scandal and a grave injustice, and I appreciate all of the work that the Honourable Member is doing with the APPG. So the Liberal Democrats would ensure that medical scandals which have disproportionately harmed women in the past can never be repeated, including the introduction of a statutory duty of candour for public officials. We as Liberal Democrats believe that every woman deserves high quality, safe and accessible healthcare. We would try and tackle the maternity care crisis by addressing chronic understaffing, improving retention and modernising outdated facilities, and we will continue to press the government to expand access to screening for conditions like breast and cervical cancer. And we would make a serious commitment to investing in women's health research. For too long, the gender gap in medical knowledge has left women without the answers or the treatments that they need. So faster diagnoses and better treatment pathways for women's cancers and gynecological conditions must be a priority for this government, not an afterthought, because this is not just about healthcare, it's about basic dignity, fairness and justice. Women should not have to fight to be heard when it comes to their own bodies, and it's time to put women's health front and centre of the NHS. Thank you.
The official opposition